Welcome to another episode of EMDR with Alice. Today we're going to talk about the flash forward procedure. I don't know if this is something you've heard before, but it is something that's in the literature, and it was developed by Logie and Zhang. And it comes from flash forward experiences that mimic flashbacks for people, but they're oriented to the future. Often they can come up after people have experienced traumatic events, and then they begin to develop fears, irrational fears, or even imagery around catastrophic events kind of happening to them in the future. So this can kind of run the gamut of fears of themselves dying in some really grotesque or gruesome way, fears of being attacked or assaulted, future fears of their loved ones being attacked or assaulted, or it could even be something like delivering a public speaking kind of engagement and then passing out and the fear of that. So there's lots of different examples of these kind of flash forwards, which again mimic flashbacks, in that it's this all of a sudden intrusive imagery that comes along with this experience of emotional distress, maybe even physiological responses to this distressing, catastrophic kind of imagery and thinking that comes up in the present moment. So we can actually address that with EMDR. There's a couple of different ways that we would approach that. So I'm going to talk through those and maybe examples of when we might use flash forward procedure, and also talk about maybe some caveats to that. So first of all, when we're working with someone that maybe has some catastrophic thinking or catastrophic imagery and flash forward experiences that they're having, then first we want to follow the general protocol, if we can, where we want to do our target sequencing. We work through the treatment plan of processing all past memories and disturbances that maybe feel connected to that distress because of a historical experience that they've had. Once we've processed those historical memories, then we've worked our way up to the present, and we would identify the flash forward as working with present trigger. And the present trigger is these flash forward events that are happening in their life. And so if that's the case, we would set up the flash forward, which is the flash forward kind of flashback, right? Except it's about the future event that hasn't happened, but we're imagining will happen. And we set that up with phases 3 through 7. So we do our typical phase 3 assessment with the present flash forward triggering, and we try to get them to identify as much as possible the details of what they're imagining will happen, so that it really kind of brings that to the forefront. We get a really good understanding of what is the imagery and the still picture of that. And then we get the negative cognition, the emotion, where they feel it in their body, all those steps of phase 3, and then we move through and process using phases 4, 5, and 6 with that flash forward. Now, sometimes it might actually be clinically appropriate to do EMDR and using phases 3 through 7 with a flash forward event for a client without necessarily processing the past. Now, just like with every client, we try to process the past first, because we understand that helps with present triggers, a lot easier processing, but sometimes it just can't happen. One reason is maybe a client's not ready to process the past, but these flash forwards are definitely impacting their current life and their functioning. And so we want to try to desensitize those as best as possible. So we might actually target the flash forwards that are happening for them using the flash forward procedure, just to help bring down the activation of those flash forwards. It might not also be a way to help a client who might be skeptical of doing EMDR processing. They're not really sure that it's going to work for them. It's a way of kind of helping them experience the reduction of activation and the reduction of that distress through something that hasn't happened, but they're imagining will happen. And it might help get some buy-in into the EMDR process. So again, if you're going to choose to do the flash forward technique, you do it just as you would do any other target memory, using phases 3, 4, 5, 6, and 7 like you would, and you're doing that flash forward event, which again is an imagined scenario that has vivid imagery and all of that distressing experience for a client, and you're setting that up as a present trigger, and then you're processing it using phases 3 through 7. Hope this can give you some ideas of how to use this technique with clients. I will say we often will see flash forward type experiences for clients that have kind of phobias, OCD type symptoms, eating disorders. Like there's some kind of future oriented terrifying fears and flash forward experiences that happen for them that are very vivid. And so this could be something that you can offer to those clients that might be able to create some space for them in reducing the distress around those anxieties and catastrophic thinking. Hope this was helpful, and look forward to you joining us next time on EMDR with Alice.